Thank you for the opportunity to present to you today. The Medicare Benefits Schedule Review Advisory Committee, or MRAC, is currently reviewing MBS allied health chronic disease management services to ensure allied health chronic disease management services adequately support patients with chronic conditions. ME/CFS is a complex chronic condition commonly associated with comorbidities. Medicare subsidised individual allied health services are currently limited to 5 services per year per patient. I'm about to show some slides with allied health providers on it, and there's a caveat. Clinical guidance for ME/CFS consistently emphasises that health service providers must have knowledge of and training in ME/CFS to reduce the risk of harm from ill-informed treatments and management. Now, the National Institute for Health and Care Excellence in the UK has their guidelines reflect the complexity. Specialist teams consist of a range of healthcare professionals with training and experience in assessing, diagnosing, treating and managing ME/CFS. They commonly have medically trained clinicians from a variety of specialisms, including rheumatology, rehabilitation medicine, endocrinology, infectious diseases, neurology, immunology, general practice, and paediatrics, as well as access to other healthcare professionals specialising in ME/CFS. And here's our allied health providers. These may include physiotherapists, exercise physiologists, occupational therapists, dietitians, and clinical or counselling psychologists. The Centers for Disease Control, the CDC in the US, has guidance that suggests physical therapy professionals, mental health professionals, and rehabilitation professionals. And it's up to us to infer which Australian allied health professions those are. The British Medical Journal Best Practice Guide for ME/CFS was updated in May 2024. The authors are James Baranoit from Georgetown University and Sonia Marshall-Gudisnik and Natalie Eaton-Fitch from the National Centre for Neuroimmunology and Emerging Diseases at Griffith University. They recommend a physiotherapist, occupational therapist, dietitian and psychologist. And there's a nurse-led protocol for multidisciplinary care in general practice that has been trialled in multiple general practices in Australia. It was developed by Bridges and Pathways Institute, a charity member of ME/CFS Australia. They recommend an exercise physiologist, physiotherapist, including neurophysiotherapist, occupational therapist, psychologist, and dietitian. Now, access to general practice is a prerequisite for access to MBS subsidised allied health care. Barriers include being homebound and bedridden, poverty due to low engagement in paid employment, and sometimes the need for carers to reduce paid employment, and our post-exertional malaise, such that clinic visits make symptoms worse and reduce functional capacity. NICE says service providers should be proactive and flexible in delivering services, including home visits, online or phone consultations, and supplying written communication. The CDC says these patients often cannot make office visits due to the severity of their symptoms. They require in-home assistance and phone or online checkups. All this amounts to people with ME/CFS needing, firstly, access to general practice. We need access to telehealth without the qualifying annual face-to-face GP consultation. We need GP clinics to be able to financially support home visits by their GPs and practice nurses. And then we need access to the allied health services. We need access to MBS subsidies for allied health at a level that allows people living in poverty to afford allied health care. We need access to an annual number of MBS subsidised allied health services that reflect the illness complexity and comorbidities. There's the potential here to slow or reverse deterioration with potential savings to health, welfare and disability services. However, this will not occur without political support and the support of the Department of Health and Aged Care to empower MRAC to develop proposals that reflect clinical guidance for ME/CFS. Thank you.